So please know that our presenters are not here to diagnose you or answer any personal or private legal inquiries. The purpose of their participation tonight is to provide information about the science, therapeutic practice, and laws surrounding medical marijuana and CBD so that you can make informed decisions about your life and your health. So without further ado, Natalie.
Hello, hi. So I get the pleasure of introducing Dr. Buckley. So Dr. Buckley is a board certified pharmacotherapy specialist. I wanted to make sure I said that right. And board certified psychiatric pharmacist who earned her Doctor of Pharmacy degree from the University of California, San Francisco. She completed her acute care pharmacy residency at Yale New Haven Health, then completed specialized residency in psychiatric pharmacy at the University of Maryland School of Pharmacy. Dr. Buckley specializes in medication management of patients involved in the legal system with treatment-resistant psychosis. She established the first comprehensive clinical pharmacy services on 8 inpatient units at Clifton T. Perkins Hospital Center, which is a maximum security psychiatric hospital. She is also one of the first faculty recruited to teach in the landmark Master of Science in Medical Cannabis Science and Therapeutics at the University of Maryland School of Pharmacy. She develops innovative courses and interventions to educate students, some of which are here, healthcare practitioners, and the public about medical cannabis. Dr. Buckley's interests include schizophrenia, bipolar disorder, medical cannabis, teaching, curriculum design, and evidence-based medicine. So it is all yours, Dr. Buckley.
Hello, everyone. I'm so excited to talk with you today about my favorite topic. Let me see. I'm just trying to share my screen. If someone could give me that option.
Okay, you should be good.
Okay, awesome. So I'm so happy to jump in. I will be discussing the science and therapeutics behind medical cannabis. So today, what are we going to learn? First, we're going to talk about what is cannabis. Then we'll talk about how cannabis is going to work in the body, what you need to know before you start medical cannabis, and how to use medical cannabis safely. So let's start on our adventure. So what is cannabis? Cannabis has been used for thousands of years for medicinal, which are medical, social, and religious purposes. So the first recorded text of cannabis being used as a medicine occurred in ancient Chinese text, and they used it for various things like pain. So it's something that has been in our culture for a very long time. So even though there are numerous states that have cannabis legalized for medical use, it's still important to know that cannabis is actually still illegal on a federal level. So federally, the government considers cannabis a Schedule I controlled substance. So what that means is that even though people are using cannabis medically, it's still considered having a high potential for abuse with no medical use. So that is important. And when the people from the Medical Cannabis Commission come and talk, I'm sure they'll talk a little bit more about the implications of this. So let's talk about what cannabis is. So cannabis actually contains over 500 unique substances. So the first substances that we'll talk about are hold on, my little mouse is a little messed up here. Okay. The first substances that we'll talk about in cannabis are the phytocannabinoids. So these are substances that are only going to be made in the cannabis plant. So phyto means plant and cannabinoid is the substance. So you might have heard of a few of these. The one that we hear of the most is going to be delta-9 THC. So that is going to be what is responsible for that high or euphoria that people get when they consume cannabis. With delta-9 THC, at low doses, it can be therapeutic. However, there are some side effects that can occur at higher doses, so we'll talk about those. Another cannabinoid that has been very intensively studied is CBD. So that's cannabidiol. And cannabidiol, it is not intoxicating, so it's not going to cause any sort of high. And it's thought that it may block some of the effects of THC. For a lot of therapeutic uses, we are going to favor cannabis strains or chemovars are what we call them that have a higher CBD ratio to the THC. Terpenes. So all of us have smelled that skunky odor when someone walks by consuming cannabis, and that is actually due to terpenes. Terpenes are compounds that are responsible for that characteristic smell. So terpenes are in lots of foods. So for instance, limonene, this is a terpene that is going to be in oranges. It gives it a nice citrusy smell. So we don't know as much about terpenes effects therapeutically in cannabis, but there's a lot to be figured out there. Next are the flavonoids in cannabis, and these are going to be what contributes to that rich color. So here's an example of rainbow kush, and you can see the purples and the reds. So how do people take cannabis? One of the most common ways is people will smoke it. So they might use a joint or a spliff, which is a cigarette paper that has wrapped up some cannabis. Eating or drinking, so this is really big. You might see cannabis in so many different ways: gummies, pills, oils, teas. Topical, so this means on the skin, so creams or lotions. People also vaporize cannabis, so they use vaping devices. They might vape dried cannabis, or there's liquid cannabis vapors, so gases that they can breathe through the device. And then there's also dabbing. Dabbing is when the process of breathing in really, really hot vapors from heated cannabis concentrates. This practice actually isn't very encouraged for medical use, but it is one way that people do use cannabis. So there are a lot of different forms that cannabis comes in. So you might have seen it as a dried flower, an oil. There are also chemically concentrated extracts. So these are, to make these, cannabis is actually dissolved in substances like butane, which is a gas, and chemically they extract a lot of the THC. So as you can see, the THC content with these chemically concentrated extracts can be really high, up to 90%. So that means up to 90 parts of that cannabis could be THC, which is the psychoactive part of cannabis. So a lot of, since the 70s, the potency of cannabis products has risen pretty drastically. It's gone from about 1 to 3% to now about 15%. And you see we can get these chemically concentrated extracts up to 90%. There's also physically concentrated extracts. So this means that cannabis, they haven't used butane to get the THC out. Instead, they're pressing it, and that can contain up to 60% THC. For edibles, tinctures, sprays, and creams, the amount of THC potency can vary. And this is just really important for people to know, just in terms of the THC potency is where we see the high amounts of THC, or where we see some of the side effects from cannabis. So it's important for people to know what they're consuming and to choose cannabis products that are going to have a lower THC potency. So there are actually cannabis products that are FDA approved. So you might have heard of dronabinol, also known as Miranol or Syndrose, Nabilone, or cannabidiol, which it has recently been approved. So dronabinol and Nabilone are actually synthetic, which means they're made in a lab. And so they're used for people who have lost the desire to eat when they're on chemotherapy agents, so medications that are used to fight cancers. And they are also used for people who get nausea and vomiting from cancer medications. Epidiolex, which is cannabidiol, is one of the more recent additions, and this is actually CBD that's made from plants, and it's used to treat some seizure disorders that are really hard to fix with medications. So now that we talked a little bit about cannabis and what is it, let's talk about some of the short-term effects and long-term effects. So people might feel confusion, sleepiness, difficulty remembering, concentrating, paying attention quickly, fear, anxiety, panic. Decreased blood pressure is something that can happen, so we have to be careful for people who might already have low blood pressure. Increased heart rate, paranoia, delusions, which are fixed false beliefs, and hallucinations. So that would be any sort of sensory perception. So hearing voices, seeing things that other people don't see, feeling things that others don't feel. So some other short-term effects of cannabis, and the more positive ones, why I guess people would use, are feeling high, a sense of well-being, relaxation, heightened sensory experience. So feeling different experiences there. In terms of long-term effects of cannabis, it is important that everyone knows that there is an increased chance of becoming dependent on cannabis, and some people go on to have substance use disorders with cannabis, which just means that now they have a problematic pattern of using cannabis, even when it is impairing their relationships with their families or their ability to do work. It's important not to drive or operate heavy machinery because cannabis can have effects on memory, concentration, the ability to think and make decisions. Long-term risk of cannabis include that with this cannabis that is smoked, this cannabis smoke can irritate lungs. So sometimes people go on to get bronchitis or different infections, long-term cough, or they might get mucus buildup in their chest. Another thing that we've been seeing is cannabis hyperemesis syndrome. So emesis means to vomit. So there have been cases, it typically happens with higher potency THC products, where people start vomiting and they can't stop. So they end up going to the emergency room. The only thing that really helps this is stopping cannabis. Hot showers as well as capsaicin cream can provide a little bit of relief. So I've talked a lot about just cannabis with the flower and the concentrates, but I did just want to spend some time talking about delta-8 THC as well as spice and K2, because these are things that you might see. So delta-8, it's been popping up in a lot of places. So delta-8 actually is a cannabinoid that occurs naturally in cannabis, except in very, very tiny amounts. So what's happening is people are taking hemp and extracting CBD from that, and then they are chemically converting it into delta-8 THC. So that delta-8 THC is very similar to delta-9 THC, which is the psychoactive component of cannabis. And that it can still cause people to feel high, to feel euphoria. There are side effects that can include hallucinations, vomiting, tremors, anxiety, and dizziness. It's really important for people to know that even though they might be able to buy Delta 8 anywhere, that it's not regulated at all by the FDA. The FDA hasn't looked at any of these products for safety or approved them for medical use. I have seen some people getting them from medical cannabis dispensaries, but still the FDA says that there is no approved medical use for them. One big thing about them is they're often mislabeled as hemp derived. So be careful because they still do have a psychoactive component and they still can get you high. So Spicer K2, this is a synthetic version of THC, and it's actually sprayed on dried plant matter. So Spicer K2, it binds really, really tightly to the receptors in our bodies that cannabis binds, that cannabinoids bind to, and it can have an array of effects. So paranoia, anxiety, panic attacks, hallucinations, convulsions, organ damage, and death. So I've had a lot of patients who come in on K2 and Spice, and it's definitely a different experience than it would be if they were utilizing Delta 9 or Delta 8 THC. So just like the Delta 8, the FDA has not approved these products for safety or medical use. With the K2 or Spice, it's impossible to know what is inside these compounds, so proceed with caution. So key points from this section is cannabis contains over 500 unique substances. Delta 9 THC is what's responsible for that high and that euphoria. Higher doses of THC are going to be linked to more side effects. The potency of THC in products has increased over time. Some chemically concentrated extracts can have a very high percentage of THC, and the FDA has not approved synthetic cannabinoids like Delta 8 and K2 or Spice, so use those with caution. So how does cannabis work in the body? We've talked so much about it. So your body is so amazing. It's organized into all these different systems, like your nervous system, where you have your brain, and your nerves, which is responsible for how you see the world and feel and think. Your circulatory system that pumps blood all throughout your body. Your respiratory system, which allows you to breathe. So there's another system that cannabis actually works on. And this system is called the endocannabinoid system. The endocannabinoid system is a more newly discovered system, and it's really interesting because most health professional schools, like schools that teach pharmacists, doctors, nurses, social workers, they don't even talk about the endocannabinoid system, even though this is the system that your body is naturally using all the time. So you naturally make your own sort of THC and CBD. The endocannabinoid system is basically a master regulation system. So that means that it can actually change the way that your body is communicating, and it can control your different organ systems. It's involved in pleasure, how you respond to something emotionally, your memory, thinking, and concentration, how you move, appetite and pain, and your senses. So cannabis actually is going to interact with that endocannabinoid system. And that's why we see these things that happen with cannabis where people might not remember things as well, or if they have difficulty thinking or a hard time concentrating. Sometimes people are slowed and they don't want to do as much. So movement and coordination is slowed a little bit. And we see that cannabis products have been used for anxiety, well, for appetite. So we talked about some of the synthetic cannabinoids that are used for patients who they're on chemotherapy agents and they have a lot of nausea and vomiting and don't want to eat. So they're used to stimulate the appetite. So what is medical cannabis used to treat in Maryland? So who qualifies? Here's a list of qualifying conditions. So that means if you have this condition, you can be approved for medical cannabis if a provider says so, and the Medical Cannabis Commission will talk about that process a little bit more. But some of the things are severe nausea and vomiting. So people who feel very, very that sticky, gross, icky feeling in their stomach and a lot of vomiting. Sometimes, like I said, this can happen with chemotherapy agents where people feel this way. So they can use cannabis for that. Severe chronic pain, cachexia, which is an involuntary wasting of the muscle. So the muscle just kind of goes away and people lose a lot of weight, and it's extreme. Anorexia, so people aren't eating. There are certain conditions where this happens, like when people are on cancer agents, or sometimes when people have HIV or AIDS. Seizures, which is uncontrolled electrical activity in the brain. Persistent or severe muscle spasms, so muscle contractions that aren't stopping, that can be very painful. Glaucoma, which is high pressure in the eye. Post-traumatic stress disorder, and then any other chronic medical condition which is severe and for which other treatments haven't been effective can qualify in Maryland. So it's important to say that these qualify for medical cannabis in Maryland. However, I want to emphasize that the evidence that healthcare providers use to treat conditions with medical cannabis isn't as robust as as traditional medicine that we have. So, for instance, in 2017, the National Academy of Sciences, they released a report where they looked at all the cannabis research that had been done. They had criteria, of course, but they wanted to see what therapeutic benefits did cannabis have. So these two rankings, conclusive evidence and substantial evidence, that meant that there was enough data out there from research trials to show that cannabis does have some sort of effect for these diseases. So that would be chemotherapy-induced nausea and vomiting, as well as chronic pain. And patients also reported improvement in spasticity and muscular sclerosis. So multiple sclerosis, which is a disorder of the nervous system where people's muscles move when they shouldn't. So there was evidence for medical cannabis potentially having a benefit here. Now, once we go down, there's not as much evidence. So there's moderate evidence for people with insomnia, but only if they have these other conditions like obstructive sleep apnea, fibromyalgia, chronic pain, or multiple sclerosis. There's limited evidence for anorexia or cachexia in HIV/AIDS, Tourette's, and anxiety and post-traumatic stress disorder. And there's no or limited evidence for everything else. So there's a lot of reasons why the evidence base is limited. And some of that has to do with the fact that cannabis is considered a Schedule I controlled substance. So that means that the government has said that it has no medical benefit and is highly addictive. That has really hampered a lot of the research that can be done. But when people go in for treatment with medical cannabis, we don't have as much robust evidence as we do, for instance, if you're going to use something like Tylenol, where there's more data on that. So it's important for people to know that medical cannabis is still not considered a first-line therapy for most conditions. So most guidelines, which doctors and healthcare providers are going to use, don't list cannabis as the first thing that people should use when they're feeling ill. However, it can be used for other disorders, and that starts with if someone has chemotherapy, induced nausea and vomiting, or chronic pain, and they've tried other things, they might be a real strong candidate for medical cannabis. Now, even though cannabis isn't first line, it doesn't mean that you can't use it. You can use it, but it's just important to know that there is a lack of evidence in this area and to make sure that you understand that. So what do you need to know before starting medical cannabis? So everyone is going to respond really differently to medical cannabis. How you respond is going to depend on different things like your sex, your age, the type of cannabis that you're consuming, and the THC versus CBD content. How you take the cannabis, what health conditions you already have, your experience with cannabis. So have you used it before, or is this your first time using it? And other foods, drinks, medications, or drugs you might be taking. And your response can actually change each time you use cannabis because it does depend a lot on your environment as well. So there are just some, here I was going through some medical conditions where we needed to double check to see if you'd be safe for cannabis. So for older adults, usually their organs don't work as well because they're just a little bit older. So smaller doses of THC might affect them more. And they also tend to be on more medications. So it's really important that their medications are looked at before they start taking cannabis, because we know cannabis can cause people to get dizzy, it can cause difficulty thinking, difficulty concentrating, and we wouldn't want an older person to fall. For people who are less than 24 years old, the brain is still developing. So cannabis can have effects on that developing brain. It's important for people who are less than 25 to avoid smoking consuming higher potency cannabis. So that means you want to choose a cannabis that has a smaller amount of THC and a larger amount of CBD, because higher doses of THC for long periods of time are going to be linked to more negative mental health effects. Some other things that are important are lung disease. Cannabis can irritate lungs, so it's important if someone has asthma or chronic obstructive pulmonary disease that they avoid the smoked route. It's thought that cannabinoids are safe in chronic kidney disease. Your kidneys are responsible for filtering your blood, but there is a chance that some cannabis can be contaminated. So it's important for people to have their kidney function checked. Your liver is responsible for breaking down a lot of different substances that come in your body, but for people who have severe liver disease, their livers don't work as well. So that means that they might have higher amounts of cannabinoids on board, and that might lead to more side effects. So it's important that these patients are monitored carefully. For severe heart and brain disease, THC can affect the circulatory system. It can cause people to have low blood pressure, high blood pressure, or a fast heart rate. So they just need to be monitored. And in pregnancy and breastfeeding, we still don't know how cannabis affects a developing baby. So it's best to just avoid so that there are not side effects. THC can also go through breast milk to the baby. So it's important for the mom to be cognizant of that. And I just recommend no cannabis during pregnancy and breastfeeding. These next few conditions are really important and all pertain to mental health disorders. So there may be a link between cannabis and higher potency THC products. Those products potentially having some effect, but we don't know, but at least an association. So they're linked to mental health disorders. So this is still trying to be figured out, but if people experience any sort of changes in their mind or behavior, and they do have a pre-existing mental health disorder, it's time to reevaluate cannabis. This one is very important, substance use disorder. It's very important to know people can get tolerant to cannabis. And then people can get dependent to cannabis, which means that their body is used to having the THC there. And then when the THC goes away, they might experience some uncomfortable withdrawal. So it's important to just make sure that when people are using cannabis, that they're not going up and up and up in their dose and using it more and more and more frequently, because that might show that that person is heading towards a substance use disorder. So it's just always important to monitor. This one is very important. So for patients who have a family history of psychosis, so that would be hallucinations or delusions, it's really important that they know that there is an association between higher potency THC products, especially when they're used very constantly, and a increased risk of psychosis. So I work with patients that have psychosis. A lot of my patients said they just wish they knew this. They would have changed the types of cannabis they consumed. So it's important to know everyone's going to respond differently to medical cannabis. There are numerous factors that influence how someone's going to respond. So it's important to be evaluated so cannabis can be adjusted for you if that's what you choose to use. So now I'm just going to go over a few quick tips about how to use cannabis safely. So it's important to let your doctor or pharmacist know if you're using cannabis because you might be on medications that need to be adjusted. I know this can be a hard thing to talk about, but your healthcare providers are there to help treat you. If they don't know what you're using, then they can't adjust for that, and it could affect a lot of different conditions that you have. I will say that a lot of healthcare providers aren't very trained in medical cannabis, and we're working to change that. But it's still important for you to let people know so that that can at least be on their minds when they're trying to figure out the best care for you. I recommend using products with a lower THC content and a higher ratio of CBD to THC. THC has been linked to a whole bunch of different side effects and issues like mental health issues, increased risk of psychosis in certain people. So it's best to just try to avoid products that have a really high THC content. In Canada, they use medical cannabis. They have guidelines for it. And most of the time, they recommend that people start with very small doses of THC for the medical conditions. If people need to go up, that is okay, but they still need to be monitored for how they're using it. The products are really difficult to dose. So it's important to start with a really low dose of THC and slowly increase 1 to 5 milligrams. You can go in and you can get a cookie that has 500 milligrams of THC. That is not going to be the best option for you if this is your first time trying to use cannabis medically. So start with a small dose. I recommend staying away from the cookies and the cakes because those are harder to dose, and using something like a gummy or an oil. So monitor the type, how often and how much cannabis you consume. We want to make sure that you can share that information with your doctor or whoever is treating you to figure out what strain, what type of cannabis is going to work best for you, because it does vary by individual, and we don't have a ton of information about cannabis except what we know about THC and CBD. So it still requires us to try to figure out a lot of other things that are going on and a lot of other factors that might influence how that cannabis is working in you. So next, you're going to report all side effects. Avoid combining cannabis with sedating medicines, drugs, or alcohol. If you start using higher doses of cannabis more frequently, seek help. And if you're smoking, smoke can be harmful, so avoid breathing deeply or holding your breath. Avoid synthetic products and avoid operating a vehicle or heavy machinery or doing tasks that require a lot of mental effort. So where can you learn more? So I suggest checking out some government organizations like the CDC and the FDA. The government of Canada actually has a lot of really good information about cannabis because they have a really robust medical program, whereas here in the United States, ours isn't as robust or as regulated. So I recommend checking them out for some good information about how to use cannabis safely. All right, so I will hand it over to the Medical Cannabis Commission.
Thank you, Tiffany, Dr. Buckley. And before the Maryland Medical Cannabis Commission, get started, from that department, we are joined by David Torres. He is the Director of Communications for the Maryland Medical Cannabis Commission, and Shannon Mack is the Commission's Outreach and Communications Coordinator. Along with them tonight are Dawn Berkowitz, and the Deputy Director of the Commission, and Christine Boyd, the Commission's Director for Public Health Research and Education. Mr. Torres and Ms. Mack's presentation this evening is largely going to cover Maryland's existing medical cannabis program, and Ms. Berkowitz and Ms. Boyd are available to expand upon and answer any questions on what is known, the data about Maryland's legalization of cannabis use for adults 21 and over. Possession and legal sales of cannabis are anticipated to become legal on July 1st of this year. So with that said, y'all can take it away.
Thank you for inviting us to this. I need to share my screen.
Yes, if Natalie could.
But yeah, thank you for inviting us to this event so we can let everyone know about, the rules and regulations concerning medical cannabis here in Maryland.
Thank you for being here.
David, you should be good to share now.
Okay, so to get our program started, it's basically called, Maryland Medical Cannabis and what you need to know. And hopefully, Shannon and I will do a good job of letting you know about the cannabis program here. If I can get these slides to work though. Here we go. Just to give you a quick overview of our program, we're going to talk about the commission itself. We're going to talk about the medical cannabis program, give you kind of a bird's eye view of how it works and what are some of the elements that make up the program. We're going to talk a little bit about the registration and the licensing process, what some of the qualifying conditions are for medical cannabis. We'll definitely talk about product safety and talk a little bit about what's going to be new for 2023. So the Maryland Medical Cannabis Commission has developed policies, procedures, regulations that support our program. We oversee all licensing, registration, inspection, testing, and safety measures that impact the program to make certain that medical cannabis is available to qualifying patients in a safe and effective manner. There are 4 primary focus areas of responsibility. The MCC is statutorily mandated to develop and operate a program that contains the following characteristics. Number 1 being licensing. This confirms that all the growers, the processors, and dispensaries meet the prerequisites and thereafter observe the rules and regulations established for the program. Registration provides a secure and efficient system for providing patients, caregivers, healthcare providers, independent testing labs, and ancillary businesses to the medical cannabis program. Compliance is a team of MCC inspectors that monitor licensees and registers for compliance with the rules and regulations and safety protocols and security measures. And then finally, safety. That area of responsibility impacts ITLs, and ITL stands for Independent Testing Laboratories. We work together with them to monitor and test cannabis products that enter the medical cannabis program. And we certify that each product that enters our program is safe and effective for our patients. The medical cannabis licensing program. This aspect of the program ensures that growers, processors, and dispensaries are in compliance with COMAR 1062. COMAR 1062 is a statutory language that was adopted by the state legislature that created our existence. COMAR 10.62 requires us to develop and manage a licensing scheme that calls for certain requirements and standards that are applicable to its licensees. The licensing scheme must be an integral part of the program to ensure that safe and effective medical cannabis is available to Maryland patients. The licensing scheme also impacts the growers, processors, and dispensaries. Medical cannabis program registration. This aspect of the program oversees the registration process for patients, caregivers, and providers into the program. Independent testing laboratories and ancillary businesses are two additional components of the program, which are also impacted by the registration process. Registration allows the MCC, allows us to monitor and track patient certifications, caregivers, and providers, as well as monitor the independent testing laboratories and ancillary businesses. Medical Cannabis Compliance Program. This aspect of the program is entrusted to our Bureau of Enforcement and Compliance. They're the guys who monitor the licensees and registrants in accordance, not in accordance, I'm sorry, for adherence to COMAR 1062 standards, rules, regulations, and guidance documents. A team of MCC BEC inspectors visits both licensees and registrant facilities to ensure compliance with safety and security measures designed to protect the well-being of program participants. The medical cannabis program safety. This aspect of the program is a partnership between the MMCC and the independent testing laboratories. The objective is to test the products for potency, stability, and contaminants, as well as to provide a cannabinoid profile to ensure a safe product and provide patients with confidence in our program. Program registration confirms independent testing laboratories compliance with a recognized international organization of standardization, which includes testing standards by requiring them to submit a copy of the certificate. I'll let Shannon take over from here. She'll talk to you a little bit how all this work gets done. Shannon?
Good evening, everyone. So now we're going to talk about how all this gets done. Statutorily created body comprised of 13 individual commissioners who are subject matter experts with backgrounds in agricultural, law, medicine, business, and research. MMCC members or commissioners are appointed by the governor and serve part-time in a voluntary capacity. They serve 4-year staggered terms, holding monthly public meetings, virtual and in person. The MMCC also has a full-time staff of more than 50 employees. Next slide. In year 2013, the General Assembly established the MMCC to oversee academic medical centers growing and dispensing medical cannabis. In 2014, the General Assembly scraps the academic model and establishes grower and dispensary licenses. And also, it authorizes physicians to certify patients for specific conditions. In 2015, MMCC may license growers, processors, and dispensaries. MMCC also accepts applications for the licenses in 2015. In 2016, dentists, podiatrists, nurse practitioners, and certified nurse midwives are added to the list of certifying providers. Also, pre-approvals announced for growers, processors, and dispensaries are announced that year as well. In 2017, dispensaries began to open and sell medical cannabis. In 2018, House Bill 2 passes, altering the makeup of the commission and expanding the program. In 2019, new applications for growers and processors are accepted. In year 2020, we began registration for auxiliary businesses. In year 2021, let me move this cursor so I can see. Edible cannabis regulations are enacted, and we go live with our Maryland one-stop portal, which is the portal that we use for our patients, caregivers, and most of all of our licensees to gather their licenses. Next slide.
Let me pick one more thing onto our timeline. Obviously, the one big thing that happened was in November 2022, the legalization of adult recreational use. Oh, there we go.
Okay, so as of September 2022, we have 98 licensed dispensaries. We did go over this in the last presentation, just some of the products that are available to Maryland patients are going to be your flower and pre-rolls, extracts, oils and tinctures, vape cartridges, capsules and patches, transdermal and or suppository. We have our lotions and ointments and edible cannabis products. So the process to legally obtain medical cannabis is step one. We register as a patient with MMCC via the Maryland One-Stop portal. We encourage potential patients to visit our website at mmcc.maryland.gov to begin the registration process for an adult or minor patient. Say that again. Oh, I thought I heard someone say something. I'm sorry. Step two would be to obtain a written certification from a registered provider. Once you are registered in our system, patients must obtain a valid written certification from a provider registered with MMCC for a qualifying condition. And you can find that list of registered providers on our website as well. Step three would be to visit a licensed dispensary. So after registering with MMCC and obtaining a valid written certification from a certified provider, you would print a temporary MMCC patient ID card if required. Patients are able to visit licensed Maryland dispensaries to purchase their medical cannabis. Next slide. So we have qualifying conditions for treatment with cannabis. I must say, I'm so glad Dr. Tiffany said this word first because I was nervous to say it. So the qualifying conditions, we have cachexia. We have anorexia, wasting syndrome, severe or chronic pain, severe nausea, seizures, severe or persistent muscle spasms, glaucoma, PTSD, and severe conditions where other medical treatments are ineffective.
Yeah. So to touch a little bit on this slide here, there are medical conditions that even though they may not be listed on, they may not appear on this list, if your registered provider has proven that other medicines are ineffective, there is a possibility that medical cannabis can be used to treat to treat other conditions that are not on this list. Okay,
All right.
next slide, go ahead.
And this is just a slide to give you guys an overview of some of our key patient stats. Do you want me to read through these numbers, or you just want to take a look at some of those?
No, they can just look at it. We can just give examples.
Okay.
Like, you know, like when it comes to like race and ethnicity, you can see that whites make up the majority of our patients, make up approximately 67% of them. You know, Asians make 2%. Black African Americans make up to 18% of the patient population. Hispanic and Latinos make up 2%. And, you know, to help the industry a little bit more, we also break it down by gender. Obviously, some patients have marked down unknown, but it looks like more than 79,000 patients are males and 77,000 make up females. And then you can see where it's broken down by age as well. Looks like the majority of the certified patients in our program are between the ages of 31 and 40. So these are just stats that dispel some of the myths about medical cannabis.
Yeah.
Next slide, go ahead. Nicole. On this slide, it just indicates that chronic pain is the most used condition to treat that is treated with medical cannabis. You know, followed by, you know, anorexia, other severe nausea and severe pain, also conditions that are treated with cannabis. All right, Shannon, go ahead and keep going.
Okay, so guidelines and regulations for safe and effective products. We use independent testing labs and product testing requirements. So we test every batch. Well, not we, the ITLs test every batch 10 pounds or less. They test the final product prior to distribution. The independent of locations that grow, process, or dispense medical cannabis. ITLs must register with MMCC as well. And the ITLs must be accredited by a third-party accreditation body that adheres to 17025 ISO IEC requirements. And David, are those on the left, are those the accrediting, or those just examples of ITLs?
These are just examples of the certificate that the ITLs issue to the commission once they test the cannabis, once they test the product. And we record all records that independent testing labs provide to us. Go ahead.
So some of the product testing and laboratory requirements, we test for potency, terpenes, and cannabinoids. They test for pesticide analysis, microbiological impurities. They test for water activity, residual solvent testing, heavy metal screens. They test for moisture content, foreign matter inspection, and mycotoxin screening, mycotoxin. Sorry, these words.
Mm-hmm. So now that brings us up with what's new for fiscal year, or actually what's new for 2022/2023. As most of you are aware of, during the 2022 legislative session, the Maryland General Assembly passed a referendum that affects a future regulation of adult/non-medical use cannabis. Known as HB1, it required a constitutional amendment to be placed on the ballot for the November 22 general election for voters to determine whether they want to vote for legalizing cannabis for adult use/recreational use. The referendum was approved by the voters and kicked in its companion bill, which is called HB 837. This piece of the legislation begins to lay the groundwork for legal/adult use cannabis program, which includes the initiation of public health campaigns. Whoops, I went one too far. The last slide just says, if you have any questions, you can email us. Let me see if I can get it back up. I'm sorry. There it is. There's our email address for myself and for Shannon. If you have any questions, you feel free to send us an email. Now, does anybody have any questions regarding the medical cannabis program or the legalization or the approval of legalization of medical cannabis?
Thank you, David and Shannon. Actually, there were a few questions in the chat, so I'm gonna just say some of them aloud. So any of you can feel free to answer. Some of them are for specific presenters. One of the questions, actually, I believe it was answered, but how do you know if a doctor is licensed to prescribe? Is there a database or list somewhere? I believe, Shannon, you mentioned that there is a database of accredited providers.
Yes. On our website, there is a button there under how to connect, under finding providers, and you would click there and it'll redirect you to our one-stop portal, and you can put in the area you live in, and or if you want to know if your doctor is in the system by name, you can do that, and it will pull up the list there.
Okay, great. Sorry if anybody couldn't hear me. Okay, the next question, which it looks like it was answered in the chat, but just for accessibility purposes, how much does it cost to a patient on the Medical Cannabis Commission? Is it a one-time payment or every year? That's how it was worded.
It is, I'm sorry, it is a one-time payment, but there is a renewal fee. Just recently, the fees to register with the commission and receive your medical cannabis card was reduced to $25, and the card is renewed, I believe, every 3 years.
No.
That was extended to 6 years.
It was
extended to 6 years. Okay.
Yes. So what has to be done every year is your registration with your doctor. That seems to be one of the things that people get confused. So your registration with MMCC, you pay your fee of $25, and that will cover you for 6 years. After 6 years, you'll have to renew. Now, what happens every year is you going to your physician to get your diagnosis, and that is something that you have to do every year, so that just like a normal checkup or something like that. So with MMCC, you're every 6 years. With your doctor or your provider, that's every year. And
all right,
your doctor fees are not associated with MMCC, so are not affiliated with us, so we would not have any say on what they charge.
all right, thank you. This is a question for Dr. Buckley. Is there anything on the horizon that you are excited about in terms of the medical marijuana and CBD, like research and all that?
Yes, so there was a bill that this year that came through that is where Biden was attempting to open some of the research opportunities around medical cannabis. And I'm such a huge advocate for evidence-based practice, and the evidence base for cannabis right now is really lacking. So hopefully if all this legislation goes through, we'll be able to do some meaningful research on cannabis, and then we can have better conclusions and advise people on how to use it better. So I'm really pumped about that.
Great. Another question, I believe this is for the commission. What does the new program, how does it affect the medical dispensaries? The adult use side of the program.
Dawn, you want to take that?
Sure. So we anticipate that the medical program will not be affected by broader legalization of adult use. We anticipate we will still have a medical program. We intend to see during legislative session over the next couple months what the framework for adult use will look like. And whether there will be different products and some different parameters put on adult use dispensaries versus medical dispensaries. So that there's more on that to come. We'll see what the legislature determines, and then the commission will regulate that new framework and get it up and running. But the medical program, regardless of adult use, we anticipate to remain.
Great. And then this was a question I had personally about, it was referencing a slide I think that David and Shannon had about the legislation. If I read it correctly, it said that the process of implementing the adult use would start in July. Does that mean that in July, adults in the county won't necessarily be able to access adult use? That's just when it will be open for dispensaries, or does that question make sense? Like, is the process just starting in July, or will people who are interested?
The question makes sense.
Okay.
So the question is, and this is, and we're getting ready, hopefully within the next 4 weeks or so to launch a public education campaign to answer a lot of these questions, because we know there are a lot of questions and misperceptions on what is the new law, what does it mean, and what doesn't it mean. So the referendum in November just asked voters, do you support legalization of possession and use of cannabis of those 21 and older? And it says on or after July 1, 2023. So it says on or after because, as I mentioned, and I'll say again, it's legislative session. During the 2022 session, legislators did not determine a framework for what sales would look like around the state. They wanted to have voters weigh in first. So now they'll need to determine that framework. And if something is decided, agreed upon, voted on, and put to regulators to get the industry up and running by July 1, that will be done. Otherwise, we've seen in a lot of states, it's at a future date, since it's something that's pretty big to get up and running. So it's really a matter of policy and regulation and what the industry is going to look like at this point. So July 1st will be the earliest that sales and use will be legal.
All right. Well, I don't see that there are any new questions in the chat for any of the presenters. So if nobody else has any questions, I just wanted to thank you all, David, Shannon, Dawn, Christine, and Dr. Buckley. Thank you all for joining us and taking the time to share all of this valuable information. To everybody here tonight, hopefully you all answered any questions that they may have had coming into the program. So, and I think that's all.
Thank you again.
Thanks for having us.
Gina,
of course.
Natalie,
Thank
Dr.
you.
Buckley.
Have a great
Everybody
evening.
Thank you so much.
Have a great evening.
Good night.
You
Good
as
night.
well.
Good
Night.
night.
Thank you.
Oh,
Yeah.
you're good.
Okay.